7. Causes of cramps and how to avoid them in people over 60. Have you ever felt that sudden and intense pain that seems to lock your muscles, often during the night or after physical activity? Why do these cramps seem to become more frequent as we age? Is there something simple we can do to avoid this discomfort and regain muscular well-being? Cramps are a common problem among people over 60, but few know that they can be related to everyday factors such as dehydration, medications, or even chronic illnesses. Understanding what triggers these painful muscle contractions is the first step to eliminating them from your life. Throughout this video, we will explore the 7 main causes of cramps, how to prevent them, and most importantly, when to seek medical help. You will discover practical information that can transform your quality of life. What are cramps, and why do they happen? Cramps are involuntary, intense, and painful muscle contractions that can last from a few seconds to several minutes. They occur when muscles suddenly contract and are unable to relax, causing pain and discomfort. These contractions are most common during rest or at night, but they can also appear after physical activity or sudden changes in temperature. Our body works through a complex system of electrical stimuli that connect nerves to muscles. When there is an imbalance in this system, whether due to lack of hydration, changes in electrolytes, or other factors, the muscles can react with cramps. Elderly people are more prone to this problem due to natural aging changes, such as loss of muscle mass and greater sensitivity to factors that trigger involuntary contraction. Identifying and understanding triggers is essential to relieving or preventing these painful episodes. 1. Dehydration. The simple mistake that could be sabotaging your muscles. Dehydration is one of the main causes of cramps, especially in people over 60. As we age, the body reduces its ability to feel thirsty, which means that many elderly people do not realize that they are consuming less fluids than they need. This lack of water in the body directly affects the functioning of the muscles, reducing the sensitivity of the nerves and altering the balance of electrolytes such as sodium, potassium, calcium, and magnesium. These electrolytes are essential for conducting the nerve impulses that control muscle contraction and relaxation. When they are out of balance, the risk of cramps increases significantly. Many people believe that eating a banana to replenish potassium solves the problem, but this is only part of the solution. The key to avoiding cramps caused by dehydration is to maintain a regular fluid intake throughout the day, consuming 2 to 3 liters of water, teas, natural juices, or soups, especially in the early hours of the day. This simple change can prevent painful episodes and improve overall muscle health. 2. Sarcopenia. How hidden muscle loss can generate discomfort. Sarcopenia, characterized by the progressive loss of muscle mass and strength, is a common condition in elderly people and one of the main causes of cramps. Although many believe that this loss is inevitable as we age, it can be prevented and even reversed with simple lifestyle changes. When muscles lose strength and volume, they become more susceptible to involuntary and painful contractions. This muscle weakness not only increases the risk of cramps, but also impairs mobility and quality of life. Sarcopenia occurs due to a combination of factors such as a sedentary lifestyle, low-protein diets, and hormonal changes. To combat this condition, it is essential to incorporate muscle-strengthening exercises and regular stretching into your daily routine. Furthermore, a diet rich in high-quality proteins, accompanied by electrolytes such as calcium and magnesium, plays a vital role in maintaining muscle health. Investing in your muscles is more than preventing cramps. It is ensuring vitality and independence for many years. 3. Extreme temperatures. The silent cold that trigger cramps. Cold is an underrated but powerful trigger for cramps, especially in the elderly. At low temperatures, blood circulation can decrease, affecting the muscle's ability to receive oxygen and nutrients necessary for optimal functioning. Furthermore, the cold interferes with the conduction of nerve impulses, making muscles more prone to involuntary contractions. Cold-related cramps are particularly common in situations such as swimming in freezing water, being exposed to wind, or sleeping in poorly heated environments. Keeping the body and extremities warm is a simple but effective preventative measure. Thermal clothing, blankets, and even the use of warm water bottles can help protect your muscles against this type of negative stimulus. Paying attention to room temperature can not only prevent cramps, but also contribute to overall comfort and physical well-being. 4. Excessive physical effort. Why exaggeration can end in pain. Intense or non-routine physical exertion is one of the biggest villains when it comes to cramps, especially for people over 60. Imagine someone who spent years with little physical activity and suddenly decides to walk long distances or carry heavy objects. This sudden overload on the body can lead to muscle micro-injuries and involuntary contractions as a natural response to stress. Furthermore, cramps caused by physical exertion are more common at night, when the body relaxes after a strenuous day. This situation can interrupt sleep and cause great discomfort, affecting muscle recovery. To avoid this problem, it is essential to maintain a routine of regular physical activities, but respect your body's limits. Stretching before and after exercise helps prepare your muscles, while regular breaks prevent excessive tension from building up. With balance and planning, physical exercise can be an ally in preventing cramps, rather than a source of pain. 5. Medication side effects. What nobody tells you about your medications. Many medications commonly prescribed for the elderly can contribute to cramps as a side effect. Among them, diuretics, used to control blood pressure or heart problems, and statins, indicated to reduce cholesterol, stand out. Diuretics, for example, alter the levels of electrolytes in the body, such as potassium, sodium, and magnesium, which are crucial for muscle balance. Statins, on the other hand, can cause direct damage to muscle fibers, resulting in pain and involuntary contractions. Furthermore, the use of multiple medications, known as polypharmacy, is common in the elderly and increases the chance of interactions that affect the muscles. It is essential that anyone who notices cramps after starting a medication talks to their treating doctor. You should not discontinue use on your own, but discussing alternatives or dose adjustments can be a safe and effective solution. With adequate guidance, it is possible to balance the treatment of chronic diseases without compromising muscular well-being. 6. Sciatic nerve problems. What does your spine have to do with your cramps? The sciatic nerve, the largest and longest nerve in the human body, plays a crucial role in lower limb function. When it is compressed or irritated by a condition such as a herniated disc or spinal stenosis, it can trigger involuntary muscle contractions, known as cramps. These cramps are especially common in the legs, such as the calves, thighs, and feet, and are often accompanied by other symptoms, such as radiating pain, tingling, or weakness. Problems with the sciatic nerve make the muscles more vulnerable to erratic stimuli, which can generate frequent and intense episodes of cramps. The best way to prevent or treat this type of cramp is to take care of the health of the spine, adopting good posture practices and strengthening the muscles that support the spine. Additionally, specific stretching exercises and physical therapy can relieve pressure on the sciatic nerve and reduce episodes of painful contractions. If the problem persists or symptoms worsen, seeing a doctor for a detailed evaluation is essential. 7. Chronic diseases. How silent conditions can attack your muscles. Chronic diseases such as diabetes, thyroid disorders, Parkinson's, and multiple sclerosis may be directly related to the appearance of frequent cramps. These conditions interfere with the functioning of the nervous and muscular systems, altering the way electrical stimuli are transmitted and how muscles respond. For example, diabetes can cause peripheral neuropathy, a condition that damages nerves and increases the risk of cramps in the lower limbs. Thyroid diseases, such as hypothyroidism, can lead to a slower metabolism, which affects electrolyte balance and muscle strength. Neurological conditions, such as Parkinson's and multiple sclerosis, directly compromise motor coordination and muscle control, making cramps a common symptom. To deal with cramps related to chronic illnesses, it is crucial to strictly follow the treatment prescribed for the underlying condition. Furthermore, adjusting the diet, including supervised physical activity and regular medical monitoring, can minimize the impacts of these diseases on the muscles. Identifying and treating the root cause is the best way to reduce the frequency and intensity of cramps. How to avoid cramps? The 3 essential steps to keep muscles healthy. Preventing cramps is simpler than it seems, as long as you adopt consistent habits and pay attention to your body's signals. The first essential step is to stay hydrated. Consuming 2 to 3 liters of fluids per day, such as water, teas, and natural juices, helps maintain the balance of electrolytes, such as sodium, potassium, calcium, and magnesium. Additionally, creating a hydration routine that prioritizes fluid consumption in the morning can avoid interrupting sleep due to frequent trips to the bathroom at night. The second step is to strengthen your muscles through regular physical activity. Exercises such as walking, yoga, and moderate strength training help increase muscle endurance and flexibility. Stretching before and after physical activity is also essential for maintaining the health of muscle fibers, reducing the risk of involuntary contractions. The third step is to invest in a balanced diet rich in essential nutrients. Fruits, vegetables, and proteins should be part of your daily diet, ensuring that your body has all the elements necessary for proper muscle function. If cramps persist despite these precautions, it is important to see a doctor to assess possible nutritional deficiencies or underlying conditions that may require supplementation or specific treatment. These simple practices can make a significant difference in quality of life, reducing cramping episodes and promoting general well-being. When is it time to see a doctor? Warning signs that cannot be ignored. Although cramps are common and often harmless, certain signs indicate that it is time to seek medical help. If you are experiencing frequent and persistent cramps, especially without an apparent cause, it is important to investigate. Cramps accompanied by swelling, redness, or severe pain in a single limb may be signs of deep vein thrombosis, a serious condition that requires immediate attention. Another cause for concern is when cramps are accompanied by changes in skin color, such as darkening or purple of the feet and fingers, which may indicate serious circulatory problems. If cramps occur along with progressive muscle weakness or atrophy, they may be related to neurological conditions or chronic illnesses that need specialized treatment. Additionally, persistent pain after cramps that hinders mobility or affects quality of life should be evaluated by a doctor to rule out muscle injuries or inflammation. In all these cases, a specialist will be able to perform tests such as blood analysis and neurological studies to identify the cause and propose appropriate treatment. Don't hesitate to seek help if you notice that something is not normal. Take care of your health and avoid future complications. Taking care of muscle health is a journey that requires attention, but the benefits are immeasurable. Imagine living your days with more freedom, without the discomfort of cramps, and with enough energy to enjoy moments with the ones you love. With small changes to your routine, such as staying hydrated, strengthening your muscles, and adopting a balanced diet, you can transform your quality of life. Remember that every step, no matter how small, makes a difference to your health and well-being. And if the cramps ever bother you again, you will know exactly how to act and when to seek professional help. Your health is in your hands, and taking care of your body is the biggest investment you can make for yourself. So get started today. Stay hydrated, move around, and take care of your diet. The future is brighter when you choose to live with vitality and strength.